April 29th, 2024, and welcome to the Healthcare Executive Webinar, Navigating Workforce Challenges and Healthcare Strategies for C-Suite Executives. So today we're going to be talking about workforce challenges. So let's highlight the critical staffing issues impacting healthcare systems globally. As we gather here today, it's essential to acknowledge the global staffing crisis affecting healthcare. Across continents, healthcare systems are grappling with shortages that threaten patient care and service delivery. These shortages stem from multiple factors, including an aging workforce, increasing demand for healthcare services, and insufficient numbers of new professionals entering the field. The implications of this crisis are profound in affecting not only the quality of patient care, but also the financial stability and operational efficiency of healthcare institutions. Addressing these challenges requires a strategic and proactive approach from all of us at the C-suite level. Our role is paramount in crafting solutions that are sustainable, that prioritize both patient and healthcare workers' needs. So today we'll explore various strategies that have been implemented globally and some emerging trends and how these can be adapted into our specific contexts. We'll look at the role of innovation and technology in bridging the gap between demand and supply of healthcare professionals. Understanding these challenges in depth is the first step towards addressing them effectively. Our discussion will also touch on the importance of global collaboration and sharing best practices and resources. So let's begin by exploring the current landscape of healthcare staffing to better understand the scale and specifics of what we're up against. So the current workforce landscape, providing statistics showing the current deficit in healthcare staffing. To put our discussion into perspective, let's look at some recent statistics. Currently, the healthcare sector is experiencing a shortfall of approximately 500 million workers worldwide. This deficit is not just about numbers, but it's also about translating them into delayed treatments, increased patient wait times, and strained healthcare workers. In 2024, the staffing gaps have widened, particularly in nursing, home healthcare aides, and primary care physicians. And these gaps are due to several factors, including retirements, burnout, and the rising demand for healthcare services as populations age. And the statistics also show a troubling trend in the geographic distribution of healthcare workers, with rural areas suffering the most severe shortages. And this imbalance poses a significant challenge for healthcare equity and accessibility. Moreover, the COVID-19 pandemic has exacerbated the situation, causing a surge in demand for healthcare services while simultaneously disrupting the education and training of new healthcare workers. The data we have points to the need for a multifaceted approach to recruitment and retention. And as leaders, our strategies must be data-driven. We must find the need to understand these trends to predict and prepare for future needs effectively. So let's now examine some of the direct impacts that these shortages are having on hospitals' operations across the globe. So let's talk about the impacts on hospital operations. So as we detail specific operational challenges caused by inadequate staffing levels lead to several operational challenges in hospitals. One of the most immediate impacts is on the quality of patient care. Understaffed facilities often experience longer wait times for patients, which can lead to worse outcomes in emergency and critical care scenarios. And staffing shortages also play an immense pressure on existing staff, leading to increased rates of error, high incidence of burnout, and higher turnover rates. Operational inefficiencies caused by these shortages not only affect patient satisfaction, but also significantly increase operational costs. For instance, to cope with shortages, many hospitals resort to hiring temporary staff at premium rates, which is not a sustainable financial strategy. Moreover, the morale and productivity of healthcare workers plummets when they are overworked, which can create a vicious cycle of dissatisfaction and attrition. In some cases, shortages can lead to partial or complete closures of departments, which further reduces hospitals' capacity to serve its community. These operational challenges underscore the need for robust workforce planning and management strategies at the executive level. By addressing these issues proactively, we can enhance both the efficiency and effectiveness of healthcare delivery. Next, we'll discuss the strategic importance of our involvement as C-suite executives in mitigating these challenges. So let's talk about strategic importance of C-suite involvement. Define the role of C-suite executives in workforce management. Well, as a C-suite executive, our role extends beyond general management to being the strategic architects of our workforce. And it's our responsibility to ensure that our healthcare systems not only survive, but also thrive and have a robust and responsive workforce. And this involves understanding the comprehensive landscape of workforce challenges and deploying strategic solutions that align with our overall business objectives. Effective workforce management by C-suite executives directly correlates with improved patient outcomes and operational efficiency. And it's essential that we stay proactive, anticipating changes, and crafting strategies that adapt to evolving healthcare needs and technological advancements. We must also ensure that our actions and policies promote a positive organizational structure that attracts and retains top talent. Our involvement is key to integrating cross-departmental efforts, ensuring that initiatives like digital transformation and patient-centered care are supported by adequate staffing. We need to be the champions of change and advocating for and implementing policies that enhance workforce stability and growth. And this includes lobbying for favorable healthcare policies, investing in employee development, and leading by example. Moreover, our strategic decisions must be data-driven, utilizing analytics to guide our actions and measure their effectiveness. So in essence, our role is to provide the vision and support needed to build a resilient healthcare workforce that can meet both current and future challenges. So let's look at the overview of the modern recruitment techniques. So listing modern recruitment strategies being employed in leading hospitals. Modern recruitment strategies have evolved significantly, and particularly how we utilize technology and social platforms. Leading hospitals are now leveraging AI-driven tools to streamline the recruitment process and target ideal candidates more effectively. Social media platforms like LinkedIn, Twitter, and even specialized healthcare job portals are now integral to our recruitment strategies, enabling us to reach a broader audience. Virtual job fairs and online open days have become popular, especially in reaching out to potential employees in remote areas or those considering relocation. Gamification of the recruitment process has also seen some promising results, engaging potential candidates in a way that showcases our organizational culture and values. As we look at employee referral programs, they've also been revamped to offer more substantial incentives for current employees to refer qualified candidates, capitalizing on their professional networks. We're also seeing a trend towards creating more personalized recruitment experiences where potential hires are treated as customers with customized communications and engagement strategies. Additionally, some forward-thinking organizations are experimenting with predictive analytics to forecast staffing needs and preemptively recruit for anticipated vacancies. To compete in the global healthcare market, we must also focus on diversity and inclusivity, ensuring our workforce reflects the communities that we serve. As we look at international recruitment drives have also expanded with programs designed to ease the integration of international professionals into our healthcare system. These modern techniques not only improve the efficiency and reach of our recruitment efforts, but also enhance our ability to attract and retain the best talent. So as we look at leveraging employee value propositions and recruitment, EVPs, we'll define what employee value proposition is and its role in recruitment. So an employee value proposition, better known as EVP, is essentially what sets us apart as an employer. And it encompasses the unique set of benefits an employee receives in returning the skills and capabilities and experience that they bring to an organization. And in the competitive field of healthcare, a strong EVP is critical for attracting and retaining top talent, and it represents our commitment to welfare and growth of our employees. A well-crafted EVP addresses key employee concerns and aspirations, such as career development opportunities, compensation, work-life balance, a supportive work environment, and it also communicates the values and the culture of our organization, aligning with the personal values of prospective and current employees. So by clearly articulating our EVP, we can make our organization more attractive to potential candidates who are looking for more than just a job, but a place where they can thrive and contribute meaningfully. Strategically, the EVP should be integrated into all of our recruitment materials and pitches, ensuring that it is communicated consistently across the platforms and interactions. This consistency helps in building a stronger employer brand that resonates with high-quality candidates who are a good fit for our organizational culture. It's important to regularly review and update our EVP based on feedback from employees and shifts in the market to ensure that it remains relevant and compelling. Incorporating real-life examples and testimonials from current employees can make the EVP more relatable and authentic, providing a glimpse into what it's like working with us is truly like. Ultimately, a strong EVP not only aids in recruitment, but also significantly boosts employee engagement and retention, as it aligns their goals with the organizational objectives, creating a shared path to success. As we look at educational partnerships, describing existing partnerships between healthcare organizations and educational institutions. Well, partnerships between healthcare organizations and educational institutions have become a cornerstone of modern healthcare workforce development. And these collaborations are designed to create a seamless pipeline of talented professionals ready to enter into the healthcare field. Such partnerships often involve Joint programs such as internships, residencies, and continuing education opportunities, which are essential for preparing students for real-world challenges that they'll face in healthcare settings. And these collaborative efforts extend beyond clinical roles to include research, healthcare IT, and administrative positions, reflecting the diverse needs of our facilities. Through these partnerships, students gain hands-on experience, which is invaluable and often leads to job offers post-graduation, thereby easing the transition from student to professional. For healthcare organizations, these partnerships allow early identification and cultivation of top talent, ensuring that graduates are well suited for the specific demands of their future roles. Educational institutions benefit by being able to offer more practical and relevant curricula that align closely with industry standards and needs, enhancing the employability of their graduates. These partnerships also facilitate a feedback loop where healthcare organizations can communicate shifting industry needs, and also ensuring that educational programs adapt swiftly to changes in healthcare technologies and practices. Regular meetings and workshops between academic and healthcare leaders help to maintain and evolve these partnerships, focusing on mutual goals and shared benefits. Successful case examples include collaboration that have led to significant improvements in patient care techniques and the development of innovation and healthcare solutions through joint research initiatives. Going forward, expanding these partnerships to include international educational institutions can also diversify and enrich the talent pool, bringing fresh perspective and expertise to local healthcare challenges. So as we talk about technology and recruitment, technology platforms are currently used in healthcare recruitment. In 2024, technology continues to play a very important role in transforming healthcare recruitment. Platforms such as LinkedIn, Indeed, and specialized healthcare job portals are now standard tools for attracting talent. Artificial intelligence, AI, is increasingly integrated into these platforms, enabling more efficient candidate screening and matching by quickly analyzing large volumes of applications to identify most promising candidates. Virtual reality, VR, and augmented reality, AR, are being used in recruitment processes to give potential hires a virtual tour of our facilities or to simulate job tasks or provide a profound insight into the working environment and expectations. Automated communication tools streamline the recruitment process, keeping candidates engaged and informed throughout the application process, and also improving the overall candidate experience. Data analytic tools help in predicting staffing needs and also planning recruitment drives accordingly, allowing us to be proactive rather than reactive in our hiring practices. Social media platforms are not only channels for advertising positions, but also tools for building community and engaging with potential employees, showcasing our culture and values. Mobile recruiting applications make it easy for candidates to discover opportunities and apply on the go, reflecting the increased reliance on smartphones for job searches. Blockchain technology is beginning to be explored for its potential to verify credentials and professional histories in secure and tamper-proof manner, thus ensuring the integrity of the hiring process. As technology evolves, Staying up to date on the latest recruitment technologies will be important for maintaining a competitive edge and attracting the best talent. Incorporating these technologies into our recruitment strategy not only optimizes the process, but also aligns with the digital proficiency that we expect from today's healthcare professionals. So as we look at enhancing workplace culture, we'll explain the correlation between workplace culture and staff retention rates. A positive workforce and workplace culture directly correlates with higher retention rates. And in environments where employees feel valued and supported, they are significantly less likely to seek employment elsewhere. Culture impacts every aspect of employees' experience, from their day-to-day satisfaction to their long-term career development within the organization. Studies consistently show that when organizations invest in creating a nurturing and positive culture, they see a decrease in turnover and an increase in productivity. For us in the C-suite, fostering a supportive culture is not just about programs and policies. It's about leading an example and setting a tone that values each individual's contribution. A positive culture also attracts top talent, as prospective employees often prioritize workplace environments over other factors. In 2024, we need to be especially mindful of the diverse needs of our workforce, including generalization differences, work-life balance expectations, and the desire for meaningful work. Implementing regular feedback mechanisms such as surveys and focus groups can help us gauge the health of our workplace culture and also identify areas for improvement. Creating an inclusive culture that comes with welcoming diversity in all of its forms is not only the right thing to do, it's also a strategic imperative for innovation, sustainable healthcare delivery. And we should celebrate and recognize achievements and milestones, both big and small, which reinforces a positive culture and motivates our team. By continuously striving to improve our workplace culture, we lay the foundation for a resilient and committed workforce that can meet the challenges of modern healthcare. So as we talk about employee engagement techniques, we'll look at employee engagement and its significance in healthcare settings. Employee engagement in healthcare is about more than just job satisfaction. It's about how invested our staff are in our mission and values, and their enthusiasm for their roles. And engaged employees are more productive, have better patient interactions, and contribute positively to the workplace environment. They are also more likely to remain with the organization long term, reducing turnover and the associated cost of recruiting and training new staff. Engagement is particularly important in healthcare, where the emotional and physical demands of the job can be high, and the stakes, patients' health, are important. And an engaged workforce is better equipped to handle the stresses of the healthcare profession and maintain high standards of patient care. Techniques to boost engagement include transparent communication from top down, ensuring that every team member understands their role in the broader mission, and regularly soliciting input and feedback from employees not only engages them, but can also lead to valuable insights and innovations that improve care. Professional development opportunities show employees that we are invested in their growth and value their contributions and want to further enhance their engagement. Recognizing and rewarding employees for their hard work and dedication is imperative, and this recognition should be both formal, such as through awards and bonuses, and informal, such as through verbal acknowledgement in meetings. Finally, ensuring that managers and leaders are trained to support their teams effectively is essential. And they are the front line of engagement and can make or break the employee experience. So as we look at benefits and compensation strategies, we're going to talk about the overview of competitive benefit packages specific to the healthcare industry. And in the competitive landscape of 2024, offering a compelling benefits package is important for attracting and retaining healthcare professionals. And benefits should go beyond basic health insurance to include mental health services, wellness programs, and flexible working conditions, which are highly valued in today's workforce. We must also consider the unique aspects of healthcare work, such as exposure to high-stress situations and offering support programs that address these challenges. Providing competitive retirement plans and long-term financial incentives can also differentiate us from other employers. Tuition reimbursement and ongoing education opportunities are particularly attractive in our industry, where continuous learning is essential, and we should tailor benefits to meet the needs of various demographic groups within our workforce, such as millennials who may prioritize career development or baby boomers who may prioritize healthcare benefits. The introduction of benefits such as paternity leave, child care support, and flexible hours can significantly enhance our attractiveness as an employer. It is important to communicate the value of these benefits clearly and effectively to ensure that employees fully understand and appreciate what's available to them. Regularly reviewing and adjusting our benefits offers in response to employee feedback and the changing market conditions will help us stay competitive. Strategically, benefits are not just a cost, they are an investment in our workforce that drives engagement, satisfaction, and ultimately patient quality excellence. So as we look at career development and advancement, we're going to discuss the importance of clear career paths and employee retention. Career pathways are essential for retention because they provide employees with a clear sense of direction and opportunities for advancement within our organization. Clear career pathways help mitigate the feeling of stagnation and dissatisfaction among staff, which can lead to turnover. These are especially important in healthcare, where professionals often seek continuous learning and growth opportunities to stay current with medical advancements. Implementing structured career paths also helps us strategically develop internal talent, which can fill critical roles more reliable than external hires. This approach not only supports employee aspirations, but also aligns their goals with the organization's objectives, creating a mutual beneficial growth environment. And career ladders should be flexible to accommodate diverse employees' needs and aspirations, recognizing that not all career growth is linear. Mentoring programs can complement these pathways, providing guidance and support as employees navigate their career progression. Regular career development discussions between employees and their managers should be institutionalized to keep these pathways current and relevant. We must also ensure that these opportunities are communicated clearly and are accessible to all employees, preventing any perception of bias or favoritism. Ultimately, investment in career paths is an investment in our staff's professional satisfaction and our organization's future leadership. So as we talk about continuous professional development, we're going to talk about the scope and the benefits of continuous professional development. Continuous professional development, as known as CPD, is about maintaining and enhancing professional skills and knowledge through ongoing learning. And in the healthcare sector, CPD is important not only for maintaining professional licenses, but also for ensuring the highest standard of patient care. Benefits of CPD include improved patient safety, more effective problem-solving capabilities, and increased staff confidence. CPD can also lead to greater job satisfaction as it helps individuals meet their career goals and keeps them engaged with the latest industry developments. From an organizational perspective, supporting CPD contributes to our reputation as a committed and forward-thinking employer. We can deliver CPD through various formats, including workshops, seminars, e-learning modules, and peer learning sessions. It's essential to tailor CPD activities to the needs of our workforce, considering factors such as job role, specialty, and career aspirations. Incorporating feedback from staff on the relevance and effectiveness of CPD activities is important for ensuring that these initiatives meet their needs and expectations. Leadership should be actively involved in CPD, both in terms of their own development and supporting their team's growth. Ultimately, our investment in CPD is reflected in the quality of care we provide, making it an important aspect of our operational strategy. As we look at leadership development for mid-level managers, we're going to talk about the importance of preparing mid-level managers for senior roles. Mid-level managers are often the backbone of healthcare facilities, bridging senior leadership and the front line. Developing these individuals for senior roles ensures that we have a pipeline of skilled leaders ready to step up when needed. This development is imperative for maintaining continuity of management and retaining institutional knowledge. Leadership development programs should focus on building key competencies such as strategic thinking, decision-making, and effective communication. These programs also help in identifying potential early and preparing them for targeted training and responsibilities. Supporting mid-level managers in their development journey not only motivates them, but also strengthens our overall leadership structure. We need to create opportunities for these potential leaders to test and refine their skills, perhaps through project leadership or involvement in strategic initiatives. Feedback and coaching are integral to this process, providing guidance and helping managers to grow in their future roles. Engagement from the C-suite in these development efforts sends a strong message about the value placed on internal career progression. Investing in our mid-level managers today prepares our organization for challenges of tomorrow, ensuring that we have the leadership capacity to navigate the future of healthcare. So as we look at succession planning, we're going to talk about succession planning and its importance in healthcare organizations. Succession planning is the process of identifying and developing new leaders who can replace old leaders when they leave, retire, or are unable to perform their duties. In the healthcare context, where the stakes are exceptionally high, having a robust succession plan ensures that important positions are never left vacant for too long. It also minimizes disruption to our services and maintains the continuity of care that patients depend on. Effective succession planning starts with identifying important roles and the competencies required to fulfill them. We need to assess our current staff to identify potential successors who exhibit these competencies or have the potential to develop them with the right guidance and training. Once potential leaders are identified, targeted development plans can be created to prepare them for future roles, including specialized training, cross-functional assignments, and leadership mentoring. Regular reviews of our succession plans are essential to ensure that they remain relevant to our changing organizational needs and external industry shifts. Involving current leaders in mentoring and development of their potential successors is important for a smooth transition and knowledge transfer. Succession planning should be a transparent process to foster an organizational culture of growth and opportunity. And ultimately, robust succession planning, it's not just a risk management tool, but also a strategic advantage that ensures our healthcare organizations remain resilient and capable in face of change. So as we look at innovative training methods, we're going to talk about innovative training methods like simulations and e-learning. So to keep pace with the rapid advancements in healthcare, we need to employ innovative training methods that could provide immersive and practical learning experiences. And so simulations, for example, allow healthcare professionals to practice procedures and decision-making in a risk-free environment, enhancing their skills without jeopardizing patient safety. E-learning platforms offer the flexibility to accommodate individual learning paces and schedules, which is particularly beneficial in the 24/7 healthcare environment. And these innovative methods support continuous learning and can be easily updated to reflect the latest medical research and practices. Blending traditional and modern learning techniques caters to a diverse workforce, respecting different learning styles and preferences. Virtual reality, VR, is another cutting-edge tool that has shown great potential in training for complex surgical procedures, as well as in patient engagement scenarios. Mobile learning applications enable staff to access training materials on the go, maximizing their time, and ensuring that they can lead in moments that suit them best. Incorporating gaming elements into training can increase engagement and retention of information, making learning more interactive and enjoyable. Feedback mechanisms should be integrated into these training methods to assess effectiveness and adapt content to meet our evolving needs of our staff. By adopting these innovative training methods, we ensure our workforce is not only skilled, but also adaptable to the technological advancements shaping modern healthcare. As we look at crisis management leadership, we're going to look at the important role of C-suite executives during healthcare crisis. In times of crisis, the leadership provided by C-suite executives becomes even more important as it sets the tone for the organization's response. Our ability to make swift, informed decisions can significantly impact the well-being of both patients and staff. Leadership during crisis involves not only logistical management, such as resource allocation and contingency planning, but also emotional leadership to maintain staff morale. We must be visible and actively involved, communicating openly with all levels of staff to foster a sense of unity and purpose. And the decisions that we make must be data-driven, considering both short-term needs and long-term consequences. Part of our responsibility is to ensure that there is a clear crisis communication strategy in place that reaches all employees and stakeholders effectively. Training for crisis scenarios should be part of our regular training regimen, preparing our team for potential emergencies. We should also cultivate relationships with other healthcare organizations and government agencies to ensure a coordinated response when crisis overlaps community boundaries. Post-crisis evaluations are important as they help us learn from the experience and better prepare us for future challenges. Ultimately, our leadership during crisis can define our organization's resilience, shaping how we are perceived both by our internal team and the community at large. Looking at managing burnout and employee well-being, defining burnout as it's prevalent in the healthcare industry. Burnout is a state of emotional, physical, and mental exhaustion caused by prolonged stress, particularly common in high-stress environments like healthcare. And it significantly impacts healthcare professionals due to the intense nature of their work, dealing directly with life and health. Symptoms of burnout include fatigue, cynicism, and feeling of reduced personal accomplishment, which can inadvertently affect patient care and employee health. The prevalence of burnout has been on the rise, exacerbated by global health crises and the increasing demand on the healthcare systems. Addressing burnout is not just about individual wellness, but about maintaining a high standard of patient care and operational efficiency. Our strategies must therefore include comprehensive wellness programs that address both the physical and mental health needs of our staff. Creating a supportive work environment where employees can feel that they can talk about their stresses without fear of repercussion is essential. Regular workload assessments can help ensure that no individual or team is consistently overburdened. We must also provide access to mental health resources, including counseling and therapy, as part of our health benefits. Leadership must be proactive in recognizing the signs of burnout and intervene early to provide support and prevent further escalation. So let's talk about adapting to regulatory changes. Outline recent regulatory changes impacting healthcare workforce management. The healthcare industry is highly regulated, and recent changes have had significant impacts on how we manage our workforce. And these changes often relate to staffing ratios, reporting requirements, and employee qualifications, directly affecting our operational capabilities. And it's important for us in the C-suite to stay ahead of these changes to ensure compliance and minimize disruption in our services. This may involve adapting our staffing models, investing in training, or modifying record-keeping systems. Staying informed through continuous monitoring of regulatory landscapes is important. And we often engage with legal experts and industry groups to help interpret these changes. Communicating these regulatory changes effectively to our staff is also important. They need to understand new requirements and how these will impact their day-to-day roles. We must also consider the financial implications of these changes, such as potential increases in operational costs or penalties for noncompliance. Proactively adapting to regulatory changes can also provide us with a competitive advantage as it demonstrates our commitment to quality and compliance. Regular training sessions and updates for our staff ensure everyone is aligned and competent with new regulations. Ultimately, our ability to adapt quickly and effectively to regulatory changes not only ensures compliance, but also enhances our organization's resilience and reputation. So let's talk about technology adoption and crisis management. We're going to discuss the integration of technology solutions during a healthcare crisis. Technology plays an important role in enhancing our crisis management capabilities, providing tools that can significantly improve our responsiveness and effectiveness. And during a crisis, technology can facilitate real-time communication across the organization, ensure that important information reaches the right people without delay. We've integrated platforms that allow for rapid data analysis, helping us make informed decisions quickly, an important capability during emergencies. Telehealth has been a game changer, enabling us to continue providing care while reducing the risk of contagion. Its role in managing healthcare crisis cannot be overstated. And we also utilize mobile health applications that empower patients to manage their conditions from home, reducing the burden on our facilities during peak times. Technology also supports our logistical operations, from tracking resource utilization and managing patient flow, which is essential in a crisis. Investing in cybersecurity is important as well, as data integrity and security are paramount, especially when handling increased volumes of sensitive information during a crisis. Training our staff to effectively use these technologies ensures that we can leverage the full potential when needed most. We continuously evaluate the effectiveness of our technological tools in crisis scenarios, making adjustments as necessary to improve our preparedness and response. The strategic integration of technology and crisis management not only supports our current needs, but also positions us to better handle future challenges. So as we look at financial planning for workforce initiatives, we're going to discuss the importance of budgeting for recruitment and retention initiatives. Strategic financial planning is imperative for sustaining our recruitment and retention initiatives. Effective budgeting ensures we allocate sufficient resources to attract and maintain high-quality workforce. Investing in recruitment and retention is an investment in our organization's future, directly impacting our ability to deliver superior patient care. And we must consider both short-term and long-term financial impacts, balancing immediate needs with our strategic vision for growth and stability. Allocating funds towards innovative recruitment methods and retention programs can reduce turnover costs and enhance our reputation as a top employer in the healthcare sector. It's paramount that these financial plans are flexible and adaptive, allowing us to respond to sudden changes in the healthcare landscape or workforce market. Budgeting for these initiatives requires collaboration across departments to ensure funds are directly directed towards the programs that provide the most significant benefit. And we also explore external funding opportunities such as grants and partnerships to supplement our budget and extend the reach of our initiatives. Transparency and how these funds are used is imperative for maintaining trust among stakeholders and demonstrating the return on investment of these investments. Regularly reviewing and adjusting our budget allocations allows us to stay aligned with industry trends and workforce needs. Ultimately, thoughtful financial planning enables us to build and maintain a resilient healthcare workforce ready to meet the challenges of today and tomorrow. So let's talk about analyzing the return on investment on workforce management. We'll look at defining key metrics for measuring return on investment on workforce initiatives. So measuring the return on investment, ROI, for workforce initiatives is important to understand their effectiveness and justifying future investments. Key metrics include employee turnover rates, hiring costs, training and development expenses, employee satisfaction scores, and patient care outcomes. These metrics help us quantify the direct and indirect benefits of our workforce strategies, such as improved employee retention, higher productivity, and better satisfaction. Analyzing return on an investment involves not only assessing financial returns, but also evaluating improvements in our organizational culture and employee engagement. This holistic approach ensures that we capture all benefits, including those that are less tangible but also equally important. We use data analytic tools to track these metrics over time, providing a clear picture of trends and areas for improvement. Comparative analysis with industry benchmarks gives us further insight into our performance relative to peers. Communicating these results to internal and external stakeholders reinforces the value of HR investments and supports continued funding. Regular ROI analysis allows us to review and refine our strategies, focusing resources on the most effective programs. In essence, a thorough understanding of ROI empowers us to make data-driven decisions that enhance our workforce capabilities and organizational health. So let's talk about operational efficiency through workforce management. We're going to discuss how effective workforce management improves operational metrics. Effective workforce management is important in enhancing operational efficiency across our healthcare facilities, and optimizing staff schedules, improving staff utilization, and reducing downtime are immediate benefits of effective workforce management. These efficiencies not only reduce operational costs, but also improve the quality of patient care by ensuring that the right staff are in the right places at the right times. Leveraging technology such as advanced scheduling software and AI-driven forecasting tools supports these efforts by predicting patient flows and staffing needs accurately. Efficient workforce management also involves streamlining administrative processes, reducing the time staff spend on non-clinical tasks, and allowing more focus on patient care. Training programs focused on efficiency practices can empower employees to contribute to smoother operations, enhancing their engagement and job satisfaction. We monitor key performance indicators, KPIs, such as patient wait times, staff overtime, and resource utilization to gauge the effectiveness of our workforce strategies. Sharing best practices across departments and even other healthcare facilities can help replicate success and improve efficiency system-wide. Continuous improvement initiatives driven by feedback from staff and data analysis keep our operations agile and responsive to the evolving healthcare environment. Ultimately, integrating efficient workforce management practices into our daily operations is a cornerstone of maintaining high standards of care and operational excellence. So let's look at preparing for future workforce trends. We'll talk about the emerging trends in healthcare workforce management. So as we look ahead, several emerging trends are set to reshape workforce management in healthcare. And these include the increasing integration of technology, the growing emphasis on multidisciplinary teams, and the rising importance of telemedicine. Staying abreast of these trends is important for us in the C-suite to ensure that our workforce strategies remain relevant and proactive. We need to consider how technological advances like AI and machine learning can automate certain healthcare tasks, altering workforce needs and skill requirements. The shift towards more holistic, patient-centered care models requires us to develop teams that include a broader mix of skills and professional backgrounds. Telemedicine and remote care services are expanding rapidly, necessitating changes in how we train and deploy our healthcare staff. These trends highlight the need for continuous learning and flexibility within our workforce to adapt to these new roles and responsibilities. And we must also anticipate legislative and policy changes that could impact how healthcare services are delivered and regulated. Engaging with educational institutions to ensure curricula reflects emerging healthcare needs will be key to preparing future healthcare professionals. And our strategic planning must include these elements, creating pathways that allow for seamless adaptation to changing healthcare landscapes. Ultimately, our readiness to embrace and lead these areas will determine our success in navigating the future of healthcare. So let's talk about the innovation in healthcare staffing solutions. we'll explore the innovative staffing solutions to meet changing healthcare demands. And so, innovative staffing solutions are important as we face fluctuating demands and evolving healthcare challenges. And these include flexible staffing models, the use of temporary or contract workers, and strategic partnerships. Flex staffing models, such as on-call systems or zero-hour contracts, provide the agility needed to manage varying patient loads without overburdening our core staff. The gig economy is making its mark on healthcare, offering professional autonomy and flexibility while providing healthcare systems with a responsive reservoir of talent. Partnerships with staffing agencies and professional networks can help quickly mobilize resources in response to sudden need, such as a pandemic outbreak or a natural disaster. We're also seeing more cross-training and role-sharing initiatives within facilities, which enhance versatility and team cohesion. Technology plays an important role here with platforms that can dynamically match staffing needs with available healthcare professionals in real time. Investing in predictive analytics can further enhance our staffing strategies, allowing us to forecast needs based on trends and historical data. We must also focus on maintaining a strong employer brand to attract top talent, especially important in competitive healthcare labor markets. Continuous feedback loops from our staff will help refine these innovative staffing solutions, ensuring that we meet both employee and organizational needs effectively. Adopting and iterating on these innovative staffing solutions will be essential for us to remain resilient and responsive in the face of healthcare's dynamic environment. So as we look at enhancing workforce diversity, let's look at number one, highlighting the importance of diversity in healthcare workforce management. Diversity within our workforce is not just a matter of equity or compliance, it's a strategic asset that enhances the quality of care we provide to our diverse patient base. A diverse healthcare team brings a variety of perspectives, skills, and cultural competencies, all of which contribute to better patient outcomes. We need to build inclusive recruitment and retention policies that attract a wide range of professionals from different backgrounds, experiences, and demographics. Training programs on cultural competence and inclusive practices are essential for all staff, helping to reduce biases and improve interactions among team members and with patients. We should strive to create a working environment where all employees feel valued and where diversity is celebrated as a strength. And our leadership teams should also need to reflect this diversity, ensuring that decision-making benefits from a broad array of perspectives. And so partnering with local communities and minority professional organizations can also enhance our recruitment efforts and strengthen community ties. Regular assessments and adjustments to our diversity and inclusion strategies will ensure that they remain effective and relevant. Also, metrics should be implemented to track our progress in enhancing workforce diversity, with results influencing future strategies. Ultimately, a commitment to a diverse workforce is a commitment to excellence in healthcare and making our facilities more adaptable, innovative, and effective. So as we look at leveraging technology and workforce management, let's look at discussing the role of technology in optimizing workforce management and healthcare. And so as we look at technology and transforming how we manage our healthcare workforce, from automated scheduling systems to advanced HR analytics that predict staffing needs. And so implementing these technologies can significantly reduce the administrative burden on our managers and allowing them to focus more on patient care and less on paperwork. So for example, AI-driven tools can be automated routine tasks like data entry and scheduling, which are time consuming and prone to human error. Additionally, technology enables more effective communication across departments and facilities, ensuring that everyone is aligned and informed. We can also use technology to monitor staff performance and well-being, identifying potential issues before they become serious problems. Mobile apps can also provide staff with access to training materials, shift schedules, and HR services at their fingertips, enhancing convenience and engagement. So as we look at investing in secure cloud-based systems, ensures that our data is accessible but protected, is also an essential consideration in today's cyber threats landscape. However, it's important to provide adequate training for all staff on new technologies to ensure that they're used effectively and to their full potential. We must also stay flexible and open to emerging technologies that could further revolutionize workforce management in healthcare. So by embracing these technological advancements, we position our healthcare organization as a modern and forward-thinking employer, attractive to tech-savvy professionals. So let's talk about creating a culture of innovation. Let's highlight the importance of fostering a culture of innovation within the healthcare workforce. So innovation is essential in healthcare, not just in terms of medical treatments, but also in how we manage and support our workforce. So creating a culture of innovation starts with leadership. We must encourage and model innovative thinking at all levels of the organization. And this involves providing opportunities for staff to suggest improvements and innovation, whether it's related to patient care, workflows efficiencies, or staff well-being. We can also program that reward and recognition innovation ideas and practices, reinforcing the value that we place on creativity and problem solving. It is also essential to provide the necessary resources to test and implement new ideas, such as funding for pilot projects or time allowances for developing new approaches. Collaboration should be encouraged across all different departments and disciplines, and as diverse perspectives often lead to breakthrough innovations, training and development programs should also include components that foster important critical thinking and creativity, preparing our staff to think differently and about challenges. By reducing bureaucratical hurdles to innovation, we can ensure that good ideas are swiftly recognized and scaled, not lost to red tape. So incorporating feedback mechanisms to evaluate the success of innovative ideas and initiatives helps refine and improve our approaches continually. And so ultimately, by nurturing a culture of innovation, we can enhance our ability to adapt to the ever-changing healthcare landscape and improve the services that we provide to our patients. So let's take a look at strategic workforce planning. As we define strategic workforce planning and its importance in healthcare, we should look at strategic workforce planning as a proactive management of staffing needs to ensure that the right people with the right skills are in the right place at the right time to meet our current and future healthcare demands. And so this planning is essential in healthcare where gaps in staff can directly be impacted, and it also impacts patient outcomes and operational efficiency. So it involves analyzing current workforce capabilities and anticipating future needs based on healthcare trends and developing strategies to meet these demands. So as we look at technological advancements, demographic shifts, and changes in disease patterns, all influence our workforce planning strategies. Strategic workforce planning allows us to manage labor cost effectively, optimizing staffing levels, and reducing the reliance on temporary staffing solutions. We also focus on internal talent development, upskilling our current employees to fill emerging roles and responsibilities, and this planning must be flexible and adaptable with regular reviews and updates as conditions change. Collaboration with educational institutions and industry partners can also help to ensure a continuous influx of trained professionals into our workforce. By aligning workforce planning with our organizational goals and patient care objectives, we can maintain a high level of service and care. Effective workforce planning is not only prepares us for the future, but also gives us a competitive edge in the healthcare market. So let's look at enhancing employee benefits. Let's discuss the evolving landscape of employee benefits in healthcare. The landscape of employee benefits is rapidly changing and driven by workforce demographics and changing expectations of what employment should offer. And so in healthcare, providing competitive and comprehensive benefits is important for attracting and retaining top talent. And benefits no longer just are about health insurance and retirement plans. They also encompass a wide range of needs, including mental health support, wellness programs, and prenatal or parental leave. So we're seeing a growing demand for flexible working conditions and telehealth services as part of benefit packages, reflecting changes in work and life dynamics. So to remain competitive, we must continually assess and adapt our benefits offering to meet the diverse needs of our workforce. And so engaging with our employees through surveys and focus groups can help us understand which benefits are most valued and where gaps might exist. We also explore partnerships with other organizations to help our benefits offerings be more economical, and such as shared access to wellness facilities or group discounts on services. Transparent communication about available benefits and how to utilize them is important for ensuring that employees understand and appreciate the value of what is offered. Innovative benefits that address the specific challenges of healthcare professionals, such as burnout prevention and career development opportunities, can also differentiate us as an employer of choice. Ultimately, our goal with enhancing employee benefits is to support the well-being and satisfaction of our staff, and which in turn improves patient care and organizational performance. And so as we look at improving work-life balance, let's highlight some of the strategies for improving work-life balance within healthcare settings. Work-life balance is particularly challenging in the healthcare sector given the demanding nature of the work and the often irregular hours involved. And improving in this balance is essential for maintaining a healthy, motivated, and sustainable workforce. And so, one strategy is implementing flexible scheduling, allowing employees to have more control over their work hours and, when possible, to be remote. We also promote the use of time management tools and training, helping employees to work more efficiently and free up time for personal activities. Support for mental health is another essential component, and including access to counseling services and initiatives designed to reduce workplace stress. Encouraging staff to take full advantage of their vacation time and providing opportunities for sabbaticals can help prevent burnout. We recognize the importance of family in our employee lives and provide support through family-friendly policies and benefits. Creating a culture that values and respects personal time not only improves job satisfaction, but also enhances the commitment to the organization. Regular feedback loops allows us to assess the effectiveness of our work-life balance and allows us to make necessary adjustments. And so by prioritizing work-life balance, we not only enhance the well-being of our staff, but also attract a wider pool of candidates who value an employer that supports a balanced lifestyle. So let's look at sustainable healthcare practices. Let's outline the importance of sustainability in healthcare operations. And so sustainability in healthcare goes beyond environmental considerations. It's about creating a system that can continuously improve and provide high quality care over the long term. And this involves implementing practices that are economically viable and environmentally friendly, and also socially responsible. In terms of workforce management, sustainable practices include promoting longevity in careers through continuous education and reducing turnover through better job satisfaction. Environmentally, we can reduce waste, promote recycling, and adopt green technologies that decrease our carbon footprint. And so economically, sustainability involves efficient use of resources, optimizing supply chains, and investing in technologies that reduce operational costs. Engaging with the community and forming partnerships can enhance our social responsibility and also improve our community health outcomes. Sustainability also involves being adaptable to changes in the healthcare landscape, and from policy shifts to technological advances and even demographic changes. Educating our workforce about the importance of sustainability practices helps to foster a culture that values and implements these principles daily. Regular assessment and updates to our sustainability strategies. It really ensures that they remain effective and aligned with our broader organizational goals. And ultimately, by investing in sustainable healthcare practices, we are committing to a future where our organization continues to thrive and provide essential care to the community. So let's look at employee development programs. Let's detail the significance of continuous employee development in healthcare. Employee development is a cornerstone of high-performing healthcare organizations, directly impacting our ability to provide exceptional patient care. By investing in continuous learning opportunities, we ensure that our staff remain competent, confident, and capable of meeting the challenges of modern healthcare. Development programs can range from clinical skill training to leadership workshops, all tailored to meet the diverse needs of our workforce. And looking at technology really plays a key role here enabling us to deliver flexible, accessible training modules through e-learning platforms that staff can use at their convenience. We also emphasize the development of soft skills such as communication, teamwork, and problem solving, which are essential in a healthcare setting. Partnering with academic institutions and professional bodies allows us to offer certifications and advanced training that keep our team at the cutting edge of medical practice. Mentorship programs are another essential component, providing less experienced staff with guidance from seasoned professionals. And feedback from these programs helps us continually refine our approach and ensuring that we are addressing the needs and real career aspirations of our employees. Recognizing and rewarding progress in these development programs not only motivates individuals, but also fosters a culture of excellence and continuous improvement. Ultimately, robust employee development programs not only enhance staff satisfaction and retention, but also elevate the overall quality of our care that we provide for our patients. So let's look at integrating wellness into daily operations. So let's examine the integration of wellness programs into the daily lives of healthcare workers. Wellness programs are essential for maintaining the health and well-being of our healthcare workforce, who are often under great stress due to the nature of their work. And so integrating wellness into daily operations involves creating a work environment that actively promotes physical, mental, and emotional health. And this can include initiatives such as on-site fitness facilities, healthy eating options in the cafeteria, and quiet spaces for relaxation and meditation. We also offer regular workshops on stress management, resilience building, and healthy lifestyle habits. Providing flexible work schedules where possible flexible work schedules where possible employees can better manage the demands of their personal and professional lives. And employee assistant programs that offer confidential counseling services are another important aspect of our wellness initiatives. And so we engage staff in the design and implementation of these programs and ensure that they actually meet the needs and preferences. So regular assessments of the impact of our wellness program on employee health and job satisfaction helps us make informed adjustments. And by integrating wellness into the fabric of our daily operations, we not only improve the health of our employees, but also enhance their productivity and reduce absenteeism. And so ultimately, these efforts lead to a more engaged and committed workforce, capable of delivering high quality patient care. So let's talk about agile management practices. Outlining the adoption of agile management practices in healthcare administration. Agile management practices adapted from the software development industry are increasingly relevant in the dynamic environment of healthcare. And so these practices emphasize flexibility, rapid response to change, and continuous improvement, aligning well with the needs of modern healthcare settings. And implementing agile methodologies involves organizing our teams around the needs of the patients and enabling them to make decisions quickly and autonomously. Daily stand-up meetings, sprints, and retrospectives are part of this approach. And so helping teams stay focused and iteratively, improve their workflows. So stand-up meetings and sprints and retrospectives are just part of the approach and helping teams stay focused and iteratively improving their workflows. And so as we look at agile practices encouraging culture of transparency and communication, where feedback is valued and used to make immediate enhancements. These methods also support cross-functional collaboration, breaking down silos between departments to enhance patient care coordination. Training for managers and staff is important for understanding and effectively implementing agile practices. And we want to monitor for effectiveness of these practices through key performance indicators, adjusting strategies in real time to meet evolving challenges. By adopting agile management practices, we can better adapt to the rapid changes in healthcare demands and regulatory environments. And so ultimately, agility enhances our operational efficiency and our ability to innovate. And keeping responsive to the needs of our patients and the community are imperative. And so let's look at enhancing employee engagement. Discussing strategies that enhance employee engagement within our healthcare settings. Employee engagement in healthcare is paradigm, and it directly affects patients' outcomes and overall organizational performance. And as we look at one effective strategy is ensuring that employees feel that their work is meaningful and that they're making a difference in the lives of their patients. And so regular communication from leadership about organizational goals and changes and successes makes employees feel included and valued. Recognition programs also celebrate both the individual and team achievements, which can also boost morale and motivation. Providing opportunities for employees to participate in decision-making and contribute their ideas on improving services also enhances engagement. Flexible working policies can also contribute significantly to job satisfaction, particularly in the high-stress field of healthcare. Professional development opportunities that allow employees to advance their skills and careers within the organization prevent stagnation and keep our engagement high. Employee wellness programs that address physical and mental health contribute to a more engaged and productive workforce. Engaging and retaining employees also involves regular surveys and feedback mechanisms to understand their needs and expectations clearly. And ultimately, a high engaged workforce leads to reduced turnover, lower absenteeism, and better patient care, which are all essential for the success of our healthcare organizations. So let's look at fostering a culture of innovation. We'll look at explaining the importance of fostering a culture of innovation in healthcare. And so innovation is not just about technology, it's also about creating a culture that encourages creativity and continuous improvement in all aspects of healthcare. And by cultivating this culture starts with leadership commitment to innovation as a core organization value. And so encouraging staff to challenge that status quo and experiment with new ideas without fear of failure is imperative. And so incorporating innovation into performance metrics and reward systems can significantly drive creative efforts. And so collaborative spaces where there are multidisciplinary teams can also come together and to brainstorm solutions and foster a sense of community and shared purpose. Continuous training and access to the latest research and technology also empowers employees to bring innovative ideas into their work. Establishing partnerships with academic institutions and tech companies can also enhance our innovative capabilities. Regular innovative challenges or hackathons can also stimulate creativity and lead to practical innovations in patient care.
Documenting and sharing successful innovations across the organization ensures that good ideas are recognized and implemented widely. Ultimately, a career of innovation not only improves patient care, but also attracts top talent who are eager to work in a dynamic and forward-thinking environment. So let's look at leveraging data for strategic decision making. Let's highlight the role in strategic decision making in healthcare. So we're going to look at data-driven decision making, which is fundamental in modern healthcare management, which impacts everything from patient care to operational efficiency. So collecting high quality, accurate data is the first step in forming the foundation for sound decisions. And as we look at advanced analytical tools, including AI and machine learning, which can help us interpret complex data sets to uncover patterns and predictions that inform our strategies. And so real-time data access allows managers to make informed decisions quickly, adapting to changes and challenges that may arise. Data on patient outcomes is also important. Staff performance and operational metrics enable us to identify areas for improvement and success. And also, integrating data from various sources such as clinical, operational, financial, provides a comprehensive view that enhances strategic planning. Training staff to utilize data effectively ensures that data-driven decisions are made and permeates all levels of the organization. Data security and privacy must also be prioritized to protect sensitive information and also maintain trust with patients and staff. Regularly reviewing and updating our data management practices, and which keeps our strategies relevant and effective. Ultimately, leveraging data not only optimizes our current operations, but also anticipates future trends and prepares us to meet them proactively. So let's go ahead and take a look at comprehensive risk management. We'll discuss the importance of comprehensive risk management in healthcare. And so risk management in healthcare is essential not only for patient safety, but also for the protection of our staff and the sustainability of our organizations. And a comprehensive risk management plan addresses potential medical errors, workplace safety, and compliance within healthcare regulations. And so we proactively identify areas where risks are the highest and implement targeted interventions to mitigate these risks. Also, training and continuous education of our staff on the highest levels of risk management practices are essential. Regular audits and assessments also help us to monitor risk management effectiveness and make necessary adjustments. Technology can play a key role in risk management, providing tools that enhance data security, patient privacy, and error reporting. Collaboration between departments is important to ensure that a holistic approach to risk management, and as issues is in one area can often affect the other issues in other areas. And so engaging with insurance providers and legal consultants also can help to understand potential liabilities and coverage options, which is also important. And so creating a culture that encourages reporting and transparency can help in identifying and addressing risk promptly. Ultimately, effective risk management not only protects against financial losses, but also enhances our reputation as a safe and reliable healthcare provider. So let's look at enhancing patient care through workforce management. We'll highlight how effective workforce management helps to improve patient care. And so the link between workforce management and patient care is direct and significant. Well-managed teams are well-equipped to provide high-quality care. Ensuring that staff levels and skills are adequately aligned with patient needs is fundamental to effective healthcare delivery. Advanced scheduling systems and workforce analytics can help predict patient influx and adjust staffing dynamically. Ongoing training and professional development also ensures that our healthcare professionals remain competent in the latest treatment methods and technologies. Employee satisfaction greatly impacts patient interaction, and a satisfied and engaged workforce is more likely to provide compassionate and thorough care. Implementing team-based care models can enhance collaboration among different healthcare specialists, improving patient outcomes. And so, regular feedback from patients and frontline staff can also provide actionable insights into how our workforce management practices are impacting patient care. Investing in leadership development from our healthcare teams fosters better decision making and problem solving in clinical settings, and also ensuring diversity within our workforce also contributes to better patient care, as it brings variety and perspectives and cultural competencies that enhance our understanding and communication. Ultimately, by prioritizing effective workforce management, we commit to delivering the highest standard of patient care, leading to better outcomes and patient satisfaction. Now let's look at building community partnerships. So let's explore the benefits of building partnerships with local communities and organizations. Forming partnerships with local communities and organizations extends our reach and enhances our impact beyond the hospital walls. And so these partnerships can provide valued resources, such as community health workers who understand local health challenges and cultural nuances. And collaborating with local schools and universities can also help in developing tailored educational programs that prepare future healthcare professionals. Community partnerships also enable us to better address social determinants of health, which can significantly affect overall health outcomes. Local businesses can be engaged in wellness programs that benefit both employees and the wider community. Joint health initiatives like vaccination drives or health awareness campaigns can also improve community health metrics and reduce hospital readmissions. Feedback from community members can provide insights into patient needs and expectations, and also help us to tailor services more effectively. Such partnerships often lead to increased community trust and support, and which are also important during health crisis or implementing new health programs. So also grant and funding from community-based projects can also support our health initiatives financially. And ultimately, by fostering strong community partnerships, we not only enhance our service offerings, but also strengthen the overall health ecosystem in our area. So let's go ahead and look at enhancing leadership capabilities. We'll talk about the importance of developing leadership capabilities within the healthcare organizations. Strong leadership is imperative in healthcare and influencing everything from organizational culture to patient care qualities. And so developing leadership qualities and capabilities ensures that our organizations can navigate complex challenges and lead changes effectively. And as we invest in leadership training programs that focus both on operational and strategic aspects of healthcare management, we need to look at empowering emerging leaders through mentorship and real-world project experiences that help to cultivate a pipeline of capable leaders. And so we also emphasize emotional intelligence and leadership, which is important for managing diverse teams and ensuring compassionate patient care. Leadership in healthcare should not only be direct, but also inspire a fostering culture of innovation and respect and also integrity. And so adapting leadership styles to be more inclusive and participative can enhance decision-making processes and also increase staff engagement. Regular leadership assessments and feedback mechanisms also allow for continuous improvement and adaptation. So we need to recognize and celebrate effective leadership through awards and recognitions and reinforcing the behaviors that lead to organizational success. And ultimately, by strengthening leadership capabilities, we ensure that our organizations are better equipped to meet the evolving demands of the healthcare sector. So let's look at integrating ethical considerations. We'll discuss the integration of ethical considerations into healthcare operations. Ethics are at the core of healthcare and guiding our decisions and actions towards the well-being of patients and fairness in operations. And so integrating ethical considerations really begins with clear policies that address common ethical dilemmas, such as patient confidentiality, informed consent, and end-of-life care. Training for all staff on ethical practices is essential, ensuring that everyone understands their responsibilities and the principles that guide them. We maintain an open environment where staff can discuss and report ethical concerns without fear of repercussion. Ethical committees, including diverse members from various departments, play a major role in reviewing practices and making recommendations. Patient advocacy is an important component, ensuring that patients' rights are always respected and prioritized. And regular review of ethical practices also helps to adapt to new challenges, such as those arising from technological advances in healthcare. Engagement with external ethical bodies and adherence to international standards can also enhance our credibility and commitment to ethical practices. And as we look at transparency with patients and the public about our ethical standards and practices, not only builds trust and confidence, but also lets them know that we believe in the services that we're providing to our patients. And ultimately, by rigorously integrating ethical considerations, we want to safeguard the integrity of the care that we provide and uphold the trust placed in us by our patients and the community. So let's look at technological optimization for patient outcomes. We'll highlight the role of technology and optimizing patient outcomes in healthcare. Technology is a transformative force in healthcare, offering new ways to enhance patient outcomes through innovative diagnostics and treatments. And so we utilize electronic health records, EHRs, to ensure that patient information is comprehensive, up to date, and accessible to all authorized healthcare providers. Telemedicine platforms extend our reach, allowing patients in remote and underserved areas to receive timely and quality care. And as we look at advanced diagnostic tools powered by AI, can also help in early detection and more accurate diagnosis of diseases, and which significantly improve treatment outcomes. We also leverage data analytics to monitor treatment effectiveness and patient progress, enabling personalized care plans. Patient portals provide individuals with access to their health information and empower them to take an active role in managing their health. Robotic surgery and other minimally invasive techniques improve precision in procedures, reducing recovery times and hospital stays. We ensure all technology implementations are patient-centered and enhance the quality and efficiency of the care that we provide without compromising the personal touch. Ongoing training for staff on the latest technology ensures that they are competent and confident in its use. And so ultimately, by providing and optimizing technology, we not only improve patient outcomes, but we also drive innovation and efficiency in our healthcare practices. So let's go ahead and look at systematic health improvements. Let's look at the need for systematic health improvements in the healthcare systems. And so, to enhance the effectiveness of healthcare, systematic improvements are necessary to address foundational issues affecting patient care and service delivery. And improvements can range from infrastructure enhancements to policy reforms that streamline healthcare processes and reduce bureaucratic hurdles. Investing in state of the art facilities and equipment is imperative for providing high quality care and attracting top talent. Systematic changes also involves updating clinical guidelines and treatment protocols to reflect the latest research and best practices. We also prioritize cross-sector collaboration to integrate healthcare with social services, ensuring a holistic approach to patient health. Emphasizing preventative care and community health programs can significantly reduce long-term healthcare costs and improve population health. Implementing comprehensive training programs ensures that our healthcare workforce is skilled, adaptable, and prepared for future challenges. And as we look at data-driven and decision-making, should be at the core of systematic improvements. Utilizing analytics to guide policy and also operational changes. And regular evaluation and feedback mechanisms are essential for monitoring the impact of systematic changes and for continuous improvement. And so ultimately, systematic health improvements require a commitment to innovation, collaboration, and excellence in healthcare management. So let's look at adapting to global health trends. Let's look at the importance of adapting global health trends in our healthcare organizations. And so as we look at healthcare on the global scale, such as the rise in clinical diseases, aging populations, and emerging health technologies, demand adaptive strategies for healthcare systems. And understanding and anticipating these trends allows us to prepare for more effective and ensure that our systems are resilient in the face of change. And by adapting, these trends may involve expanding geriatric services, enhancing chronic disease management programs, or even investing in advanced medical technologies. Global pandemics and health crises in recent years underscores the need for healthcare systems to be flexible and responsive. And by collaborating internationally to share knowledge and resources and best practices can greatly enhance our ability to adapt to and influence global health trends. Training our workforce to handle diverse and complex health issues is important for keeping pace with global developments. And adopting sustainable health practices and promoting environmental health are also important in responding to global health challenges. Leveraging telemedicine and digital health platforms can help us reach a broader patient base and also offer services more efficiently. We must maintain a vigilant and proactive community, continually researching and responding to global health dynamics. And by staying adaptable to global health trends, we ensure that our healthcare system remains effective and relevant and prepared to meet the challenges of tomorrow. So as we conclude this detailed session on workforce management challenges and strategies in healthcare, I invite you to ask any questions that you might have. This is an excellent opportunity to explore into any aspects of today's discussion you wish to understand better. I encourage you to participate actively in this dialogue. Whether you have a question or you require clarification or you want to share your perspective, please feel free to do so. Your insights and queries are invaluable for enriching our conversation. A few guidelines to ensure that our Q&A session is effective. When asking your question, please articulate it concisely and clearly. This helps me to comprehend and understand your query more effectively. Let's keep our questions focused on the topic at hand. We're here to discuss workforce management and healthcare, including recruitment, retention, and training strategies. Questions that are pertinent to these topics will be most advantageous for everyone involved. So let's maintain a respectful and constructive tone during our interaction, and a positive and courteous exchange of ideas benefits us all. After the Q&A, I will provide some final thoughts and clarifications to summarize the key points from our session. I appreciate your participation and engagement, so let's begin our Q&A. Who would like to ask the first question? What are the main factors contributing to the global staffing crisis in healthcare? The global staffing crisis in healthcare is primarily due to an aging workforce, increasing demand for healthcare services, and insufficient numbers of new professionals entering the field. These factors collectively strain healthcare systems, impacting the quality of patient care and the operational efficiency of healthcare institutions. Understanding the factors behind the staffing crisis leads us directly into our next topic, which is the tangible effects of this deficit on the healthcare system globally. So, how does the current deficit in healthcare staffing affect patient care and service delivery? The shortfall of approximately 5 million workers worldwide in healthcare leads to delayed treatments, increased patient wait times, and strained healthcare workers. This deficit exacerbates issues in service delivery, particularly in nursing, home health care, and primary care, severely impacting patient care quality. So now that we've seen the broader impact of the staffing shortfall, let's explore the specific operational challenges hospitals face due to inadequate staffing levels. So what operational challenges do hospitals face due to inadequate staffing? Inadequate staffing levels in hospitals lead to longer patient wait times, increased rates of medical errors, high incidence of staff burnouts, and high turnover rates. These challenges not only affect patient satisfaction, but they also increase operational costs significantly. Given these operational challenges, it becomes clear why leadership at the C-suite level is important. So let's explore how executives play an important role in managing and mitigating these issues. So what is the role of C-suite executives in healthcare workforce management? That's a really great question. Thanks for asking. C-suite executives in healthcare are responsible for being strategic architects of the workforce, ensuring that staffing aligns with overall business objectives. Their improvement and is also important for effective workforce management, which directly correlates with improved patient outcomes and operational efficiency. So with the strategic role of C-suite executives in focus, it's interesting to consider the modern techniques that they might employ. So let's discuss some of the innovative recruitment strategies that leading hospitals are now using. So the next question is, can you list some of the modern recruitment strategies being employed in leading hospitals today? Leading hospitals are employing modern recruitment strategies such as using AI-driven tools for efficient candidate screening, leveraging social media platforms for broader reach, hosting virtual job fairs, utilizing gamification and recruitment processes, and enhancing employee referral programs. Speaking of strategies to attract top talent, a key tool is the employee valuation proposition. So let's define what an EVP is and explain
its significant role in the recruitment process. So what is an employee value proposition, an EVP, and its role in recruitment? An employee value proposition, an EVP, is a unique set of benefits an employee receives in return for their skills, which is important in attracting and retaining top talent. A strong EVP effectively communicates the values and the culture of an organization, making it more attractive to potential candidates. Effective recruitment strategies, including a strong EVP, often require robust partnerships. So let's look at how collaboration with educational institutions are proving beneficial. So the next question is how do educational partners benefit healthcare organizations and institutions? And I believe that partnerships between healthcare organizations and educational institutions create a pipeline of talent ready to enter the healthcare field, and that these partnerships often offer hands-on experience through internships and residencies, important for preparing students for real-world healthcare challenges. And healthcare organizations identify and cultivate top talent early. Partnering for talent development is not just one piece of the puzzle, but advancing our discussion. We'll now consider the technology platforms that are transforming healthcare recruitment today. And the next question is what technology platforms are currently used in healthcare recruitment? And technology platforms such as LinkedIn, Indeed, and specialized healthcare job portals are widely used. AI for candidate screening, VR and AR for virtual tours and job simulations, automated communication tools for candidate engagement, and data analytics for predictive recruitment are all integral to modern healthcare recruitment. Technology not only streamlines recruitment, but also enhances workplace environments. So let's shift our focus to how positive workplace cultures impact staff retention. And that is, the next question is, how does a positive workforce culture influence staff retention rates in healthcare? A positive workplace culture directly correlates with higher retention rates by creating an environment where employees feel valued and supported. And this culture reduces turnover, increases productivity, and attracts top talent, ultimately enhancing patient care quality. So, building on these ideas of workplace culture, let's explore another important aspect that directly influences the effectiveness of a healthcare setting, and that's employee engagement. We'll discuss why it's particularly important in healthcare environments. And so the next question is what significance does employee engagement hold in healthcare settings? Employee engagement in healthcare is important as it influences productivity, patient interactions, and workplace atmosphere. And so engaged employees are more likely to stay with the organization, reducing turnover and associated costs. High engagement levels in healthcare settings are essential for maintaining high standards of patient care. Having explored how engagement impacts healthcare outcomes, we now have a fuller understanding of the interconnected nature of our workforce strategies and their effects on patient care. So, to summarize the key strategies and insights discussed throughout the presentation, today we explored a comprehensive range of strategies from addressing workforce challenges in healthcare at the C-suite level, enhancing leadership capabilities, fostering a culture of innovation, and leveraging technology are all foundational to advancing our healthcare system. And we discussed the important role of ethical considerations and systematic improvements in health and maintaining trust and effectiveness in the healthcare delivery. We also talked about adapting to global health trends and integrating wellness into our operations, which are essential for sustaining our workforce and improving patient outcomes. The importance of data-driven decision making cannot be overstated, enabling us to optimize operations and anticipate future needs accurately. We also discussed community partnerships and focus on preventative care, which also play a significant role in enhancing our service delivery and community health metrics. All of these strategies are interconnected and require a holistic approach to implementation, guided by strong, informed, and proactive leadership. So, as we move forward, our focus should be on continuous improvement, adaptability, and a commitment to excellence in all aspects of healthcare management. I encourage each of you to consider these strategies, which can be implemented or enhanced in respective areas to meet the evolving demands of healthcare. Together, we can achieve a transformative impact on our healthcare systems, ensuring that we are resilient, efficient, and above all, centered on providing exceptional patient care. So as we wrap up today's discussion on workforce challenges in healthcare, I want to direct you to some valuable resources and references that will enhance your understanding and help you effectively manage these issues within your organization. So some official documentation and in-depth analysis for comprehensive guidelines on healthcare workforce strategies. I recommend exploring the resources provided by the World Health Organization, the WHO, and the Internal Labor Organization, the ILO. These documents offer detailed insights into global best practices in healthcare staffing and policy making. And for a wider understanding of workforce policies, visit the American Hospital Association's the AHA Workforce Center. This resource offers extensive analysis on the dynamics of workforce management in the healthcare sector, including strategies for addressing staffing shortages and enhancing retention. For updates on the latest trends in workforce management, the United States Bureau of Labor and Statistics provides valuable data and analysis that can help you understand employment trends, job predictions, and other essential workforce-related information in the healthcare industry. And staying updated with current discussions and research. For scholarly articles and research studies, look into journals such as the Journal of Healthcare Management and Healthcare, the Journal of Delivery Science and Innovation. These publications are excellent sources of the latest research, case studies, and innovative strategies in healthcare workforce management. For dynamic discussions and professional insights, engage with healthcare management forums and blogs like the Healthcare Management Forum and Modern Healthcare. These platforms are excellent for sharing experiences, participating in discussions, and gaining insight from peers and experts in the field. These resources will keep you informed and well equipped to tackle the complex challenges of managing healthcare workforces. They will support your efforts to implement effective strategies and foster a sustainable, supportive working environment in your organizations. So thank you for your active participation today. Your dedication to enhancing healthcare through improved workforce management is really inspiring. And I look forward to seeing how you all drive progress in your respective roles. So as we conclude today's discussion, I encourage you to keep this dialogue going. If you have any questions, new ideas, or topics you'd like to discuss further, please do not hesitate to get in touch. My name is Greg Wahlstrom, and I'm the President and Chief Executive Officer at the Healthcare Executive. And you can reach me at info@thehealthcareexecutive.net for any inquiries or discussions. Feel free to connect with me on LinkedIn. My profile is Greg Wahlstrom as well. I regularly post updates and insights that may be of interest to you. In terms of scheduling a conversation, I'm available from Monday through Friday from 9 a.m. to 5 p.m.
Central Standard Time. I'm also willing to find other times if those hours do not work for you. In terms of communication preferences, while email is the quickest way to reach me, I'm open to other methods that suit you better. So let's continue to engage and share knowledge that can propel our field forward. I look forward to hearing from you soon and exploring the new possibilities together. So wrapping up today's session, I'm eager to keep our interaction active, and I'm open to various forms of collaboration, including professional discussions, joint projects, or consulting opportunities. I'm here to work with you. So stay connected with future events, talks, webinars, or workshops. These are great opportunities to enhance your knowledge and connect with peers interested in workforce management. Appreciation and thanks. I sincerely appreciate your activity for the participation today, and your contributions have significantly enriched our discussion. So please feel free to contact me if you have any questions from today's session or want to explore new ideas. I'm ready to connect and explore potential collaborations. So thank you once again for your engagement, and I look forward to our future interactions. So as we conclude, I just want to express my appreciations to everyone who contributed their time and effort to making this session impactful. To my team members, your dedication and insight have been insightful and essential in bringing this session to life. The spirit of the teamwork has been key to our success. A special thanks to the healthcare executive. Your support and resources have been essential in making this session informative. This organizational support is what allows us to have such productive discussions. The foundational data and research for this presentation were carefully chosen from essential health workforce management sources, including guidelines, scholarly journals, and strategic documents. I also want to acknowledge the talented individuals responsible for visuals and graphics used today. Your efforts have significantly improved our interaction with the material presented. So that concludes today's presentation. Just as a reminder, this webinar was being recorded, and it is 2024 copyrighted the Healthcare Executive. And that ends today's session.